Good afternoon and welcome to Webinar Wednesday in this our 9th year of offering up-to-date and informative webinars to the HTM industry. Today we are joined by Ben Stock, Director of Healthcare Product Management at Ordr, and Dustin Smith, Senior Advisor Solution Consultant at Nuvolo. Webinar Wednesday would like to thank our sponsor Ordr. Ordr is focused on making connected device security simple through their zero-touch agentless deployment, one common platform for multiple stakeholders, and automation of policies to secure devices. With Ordr, you know exactly what's connected to the network in real time, all the time. You will know what's vulnerable, what's behaving maliciously, and why. You can then automate response for any connected device and enforce on any networking and security infrastructure. Visit ordr.net for more information. Just a quick reminder that TechNation is headed to our Spring MD Expo at the Woodlands Waterway Marriott Hotel and Convention Center in Houston, Texas, from April the 11th to the 13th. So please join us for 3 days of education, networking, and the latest advances in medical technology products and services. Registration is open, so for more details, please visit mdexposhow.com. Today's webinar is eligible for 1 CE credit from the ACI, and you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit from the ACI, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. Let's kick off today's webinar by giving away one of our Webinar Wednesday t-shirts to the attendee that can tell me the answer to the following trivia question. As it was Valentine's Day yesterday, what state produces most of America's red roses? Answer now using the questions feature on your dashboard, and I'll reveal the answer at the end of the webinar. We'll wrap up today's presentation with a live Q&A, so please submit your questions anytime using the questions feature on the webinar dashboard. As I mentioned earlier, our presenters today are Ben Stock and Dustin Smith, and they will be discussing more data, more problems, data reconciliation in the modern HTM environment. Ben and Dustin, you may begin whenever you're ready.
Thank you very much. As mentioned, my name is Ben Stock. I'm the Director of Healthcare Product Development for Ordr. Prior to being at Ordr, I spent 18 years in the clinical engineering field for SSM Health, and one of my responsibilities was data management. So this is a very near and dear topic to my heart, and something that has caused me a lot of heartburn and strenuous evenings. I've been doing data, transition from one CMMS to another, and also reconciliation and making sure what's actually there is what's there. I'm joined by Dustin Smith. I'll let Dustin introduce himself and take the beginning of the presentation.
Yeah, thanks, Ben. So I'm Dustin Smith, Senior Advisory Solution Consultant at Nuvolo. I've been with Nuvolo just shy of 3 years now. And one of the big things I've noticed throughout my career, I've worked in kind of a variety of different operations roles between supply chain management, finance, and also healthcare technology management. And really, we live in a digital world today. When we think about the needs as it pertains to healthcare technology management, we need really a solid data foundation to ensure our success from really not only our accreditation standards, but also ensuring operational effectiveness. Because when it comes to things like understanding what PMs need to be done, more often than not, we're going to be aligning our PMs on a model basis. And so if we have, for instance, a Cigna in the system that's written 3, 4, maybe even 5 different ways, or if we've got 10 variations of GE, we're going to have a really, really difficult time ensuring we're following standard practices as it pertains to the way we interact with our vendors, as it pertains to the work performed against specific models, how we're addressing potentially AEMs that are ultimately aligned with our asset types, and then also understanding where our equipment's located. Do you have ultimately locations set up within your system in a meaningful way where I can start saying, here are all of the devices that are on a particular floor? Or are we still really doing a lot of our location information is really only stored at a department level? So having the clean data to make the appropriate decisions, at the end of the day, it's hard. And so what Ben and I are going to try and address throughout this presentation is, why is it hard? And how do we snap a chalk line that can ultimately ensure a foundation of success? And how do we make sure in moving forward that we have clean data? And then Ben's going to go through a conversation that kind of goes that much further, looking at anything beyond that chalk line where we've put in place the appropriate business processes, standards, governance, and appropriate tooling. That's what makes us successful in now. But what about the years that we spent with poor data? How are we going to reconcile that? Because again, really, more data, more problems. And when we think about our integrated delivery networks or health delivery organizations that we're supporting, or even our customers, if you're an independent service organization, we're working with data that, God forbid, maybe it's close to like 40 or 50 years old. You may have some devices that you still work with that are in service from the 70s. Almost guarantee you're still working with some equipment from the 80s. And so in terms of being able to really move forward, there's the two elements. So we've got what we're working with right now and moving into the future, and then also our legacy data that we ultimately hope we can find a meaningful method to clean that up. So let's start looking at our chalk line, right? How do we create a foundation? What does a foundation look like? Well, first and foremost, we need to ensure that our assets are onboarded appropriately. And that's more than simply going through an electrical safety test, closing a work order, and putting the device into the wild. There's also that foundation from a digital perspective. What does your asset record look like? Do you have standard nomenclature? Do you have the governance structures in place within your organization where somebody's saying General Electric Healthcare is put into the system as GE Healthcare? How did you change your manufacturer when Alaris pumps were picked up by BD? How do we manage the consistent flow of information and the changes that occur on a daily basis? And where this gets so critical is especially as it pertains to technical information right now. We're having more and more network connected devices on a daily basis. How do we understand which devices have the outdated operating systems that ultimately need to be replaced, or even vulnerable like software revision numbers? When you get a recall for a particular software version number, we'll say 9.33.2, how do you know which of your pumps are rocking that software revision number within your system? This is one of the areas where the connectivity makes a tremendous difference. And that's one of the areas where if you understand the platforms you're working with, or if you have the appropriate tooling, in this case, Nuvolo and Ordr, you can start taking and pollinating some of your device information from really a standard. And that's something that we'll be discussing further on in our presentation. So going back to successful onboarding, right? And this idea that we need to ensure that we're able to bring the appropriate digital information in, this is absolutely critical to our business. So with that, we're going to go ahead and walk through kind of what onboarding looks like within Nuvolo and where we can start setting up the appropriate hooks and means for transferring information so that we can better leverage some of our tooling. Going back to the idea that with the appropriate governance and standards around nomenclature, we can start driving operational effectiveness and better compliance. I'm going to hit on certain elements within the device record where we really need to be focused on consistency. So as I'm onboarding, we're going to call this our Webinar Wednesday pump. If I can remember to spell. And then I'm starting this process with just this information. I can start a pre-procurement asset and start tracking information as it comes along. I may have a specific buyer who is ultimately filling out some of this information side by side with me. Worth noting, right now, I have a flag that says I need somebody to review the information within my work order. So going back to, again, the notion that one does not simply onboard assets, that there's more to it than simply performing a functional test and an electrical safety test when it's deployed. Let's start thinking through what information do I need to really affiliate with this device to ensure I'm able to not only track this from a standard perspective, what is this pump, right? But then also how we can connect this to others and ensure that we're staying compliant. So I'm gonna go ahead and work through my work order as quickly as possible because we're really focused on kind of our digital asset for the sake of this demonstration. So safety inspection completed with on-site service. All right, so now that I've completed my work order, I have a system that's letting me know I need to appropriately apply updates directly to my onboarded asset. So I'm driving ultimately what information will be stored against my device record. I know that I need to put in my owning department. We're going to say General Biomed owns these mobile medical devices because our pumps are likely going to float around quite a bit. I know that I actually put this in room 203K and thinking through our standards, right? As I'm putting in my manufacturer, it's actually going to be creating an appropriate dropdown associated with this. So now if I look at Baxter, I'm limited only to any of our Baxter devices. So this is one of the ways where, again, we're driving specific information that flows into the system. And furthermore, when it comes to elements like network connectivity, if I think about the ways where I may be communicating with alternative systems and some of the information that I need to track, odds are I need to tie this out through likely either a serial number or even potentially a MAC address. So now I'm able to, once I say that this is network connected, I could plug in my MAC address, and I'm going to now have a meaningful connection that allows me to start reconciling information. One of the benefits of having a passive monitoring solution is that you have access to additional data. You're able to not only load in your technical information, whether that's your operating system, your software versions, whether or not PHI has been detected from a device, and even security state information, but you can also start leveraging the nomenclature that is stored in a packet. And that those activities can be tracked and monitored through our reconciliation tasks. And with that, I'm going to go ahead and turn this over to Ben so that he can continue our journey in regards to what we're consistently hearing from customers and also how we can transition towards fixing ultimately some of the legacy device data collection.
Thank you, Dustin. You see my screen all right, I'm assuming?
Yep.
Perfect. I do also want to remind you, if you have any questions, please put them in now. As we're going along here, we will pause and try to address them as they come in, if we can. So yeah, like Dustin said, we've got problems, you know, and you can solve your current problems by following proper process and procedure for the new devices that are coming in and collecting the right data. But what about everything we didn't get that data for in the first place? You know, we've got to collect it. We have to know a lot of this information so that we can track vulnerabilities and so forth, and recalls that was mentioned before. So you got a couple options out there. There's no silver bullet. None of these are going to be easy. I think we made that pretty clear. This is not going to be a fun, easy process. It's just something that needs to get done. There are companies out there that will help you with this, and you can do a couple different options. You know, they come in and they go find these pieces of equipment. You set the parameters. We want to collect MAC addresses, IP addresses, serial numbers. You know, and the cost of it depends on, you know, how many devices there are, how many attributes you want to collect. And these are good. It is a solution. They're relatively quick. They're usually in and out, and depending on the size of your organization, you know, a week or two. It's a one-time expense. It doesn't keep recurring. You pay for it once, you feel it once, and you move on. And generally, in the big scheme of things, it's relatively inexpensive. The negatives of this is that, you know, it's a shot in time. You're looking at all your information right now based on the information there. So if you come in and get a software upgrade, if you change an IP address, an AE title, these things, you change out a network card, your MAC address is going to change. These things are going to change immediately once they are done with their inventory. And it can be a little intrusive, you know, going into patient rooms to collect information off infusion pumps, pausing your CT scanner between patients to get the information out of it, can cause issues, you know, with delivering patient care. There's an alternative option to these with these events. Sometimes because your local staff knows your environment better than other, you know, an outside entity, you can bring in an entity to do the day-to-day tasks, the PMs and so forth, and then have your staff go out and look and gather this information. Which kind of comes into the next point, which is using internal resources. A lot of this equipment that is connected is something that's on a PM schedule, and we are going to maintain once a year minimum, or once every 2 years. We can set part of that PM cycle as collecting this information. It is going to add to your already busy day, but it is something that needs to get done. So, you know, it could be a way of doing it. But you're looking at 1 year to 2 years, depending on your PM cycles, before you have all this data collected. And you lose that accuracy the day after it's collected. It could be changing, and it could be very difficult to keep that data up to date. You'd have to do it every year and make sure you're updating it, but it's only current on that first day. And this takes away from things that biomed needs to do, your maintenance and your repairs and so forth that are critical to delivering clinical care. And then the third option is an automated discovery tool. So I'm sure you've all heard about this, and it's what's out there. They're in a majority of the hospitals now have some form of an automated discovery tool that's going to passively monitor your network and look and see, watching the traffic go by and using some different methods that we'll get into later, determine what those devices are. And there are limitations to this. Some devices you're going to get serial numbers on, some devices you're going to get software revisions on, and others aren't. It really is dependent on what is in the traffic that's being seen and what can be identified based on the patterns that the device communicates within. There's a lot of positives to this. It's really quick. Usually in the first couple hours, days, you're going to start getting a pretty good image of what you have on your network as far as medical devices go. It's updating in real time. Software revisions change, MAC cards get switched out, things of that nature. It's going to update that data within the system. And then a lot of these systems also have additional functions outside of just identifying what's on your network. They can also be used to protect what's on your network for those devices where you can't use traditional IT agent-based methods or scanning to identify them. And the next great thing is that they're going to identify new devices that may slip through your onboarding process. It's really hard to onboard an asset when you don't know it exists in the first place. This isn't all positives. This is generally, these are going to be more expensive than the other methods before. It's going to typically be licensed, so there's going to be an ongoing expense to that. And you don't just plug them in and they run. You've got to do a little bit of work with them. There has to be somebody that's monitoring the system. It's not a full-time job, but there's somebody does need to kind of take ownership and responsibility of the system. There we go. So we talked about how these systems collect data. For the most part, all of them, you can throw a name out there for any of these systems, they're all going to be passive. They're going to watch information that's on your network, and that's going to come in through a couple different methods: span, tap, or a packet broker. They all deliver information, data. Span is more at the switch level. They make a span port on a main switch. That data comes through. Taps are multiple copies of traffic. And then a packet broker is a solution that you buy that collects all your packets and then shares it with other solutions. But in the end, you're just getting a whole bunch of data to a system that can then analyze it and figure out what's going on with this. There's other tools we use to get additional information, polling the switches to see what's connected, looking at firewalls, different threat visibility feeds. If you are using a Rapid7 or a Tenable, that can also be brought into these systems to add data to the information about the devices. On the right side, these active solutions, this is what your IT team is typically going to be used to using. They're going to have endpoints on the device, an application that's installed on the device that relays information back about the device. Vulnerability scanners that reach out to the device and try to exploit vulnerabilities that are known and could be present on that solution to write them off and say they're not. And things like WinRM, which gathers information about the Windows installation and patches and so forth that are on the system. These are all active methods and typically not allowed on most medical devices that we're seeing. Vendors are getting better. They are approving a couple different endpoints, antivirus solutions to be installed on there, but that's not going to say that the one that you have, that your IT department wants you to use, is the one that the vendor has chosen to approve. The vendors cannot go through and validate all the different solutions out there. So a little more on passive instead of active. You know, passive, it will not impact your IoT, IoMT devices, your medical devices. We're not reaching out to them. We're not putting anything on them. We are simply watching what they do in the communication path to figure out what they are. It's not dependent on the system being online all the time. A lot of your scanning solutions for vulnerabilities scan in the evening, 2, 3, or in the morning, 2, 3 in the morning, when a lot of your medical devices are turned off. So if they were leveraging that to try to get information, these devices aren't turned on. So what we're doing is we're watching it all the time and then collect the information when it is turned on. And then the times between these active scans, if new devices come on the network, they're not scanned again until the next cycle of that scan, where we're actively monitoring the entire network. We can see anything when it immediately touches the network. So how's this work? So we're looking at these raw packets coming in from your span and your tap, and they're typically going to go into a sensor, and the sensor is going to break down that data and try to figure out what the devices are based on the information in the packets. And then stuff happens. We're going to call it the magic, and we'll go a little bit deeper into the magic later because it's really not that magic. But you're going to use that information, and you're going to get information like you see in that's highlighted in the device information here on the right. MAC address is super simple. The manufacturer, model number, serial number, the operating system, the software revision, I should have boxed that one. And then the protocols that are using, those get a little more difficult. Those are just not seen by your average networking tools. You have to dig down into the information that you see to pull those pieces of information out of that particular protocol. So with that, we look at the raw data. So the raw data is a bunch of ones and zeros. We're seeing it in hex here on the left, and then breaking it down into raw text that we can understand kind of in the middle there. So this is called DPI, or Deep Packet Inspection. All the vendors that are doing this type of device of passive monitoring are using deep packet inspection inside the protocols to determine different parts of the information to then determine what that device is. So we can see this here. We're pulling out the software revision, the serial number, the MAC address from this packet, and then populating it under the device information. Different packets would yield information about the manufacturer, or the header could tell you what protocol is being used. And all of those over time build a profile for that device that allows us to gather this information. And when we talked about before, things like that software version information is very important when it comes back to determining whether if a recall that's been released is relevant to you or not, and could be the differentiator between you taking 5 minutes to figure that out by looking here, or having to go and find a device and figure out what that software revision currently is running. So where we get some additional information, and specifically here we're talking about Nuvolo. So with integrations with products like Nuvolo, we can pull additional information. Dustin put in the MAC address earlier. So when we see that, we know we can make a connection between this device and what the information is within Nuvolo. And we can pull that back to Ordr and show you things like, who the supporting department is, the owner of the piece of equipment, where it was originally located when it was distributed. And this also works with many other solutions that store data about the devices, if they're, if they're a Rapid7 scanner, or even within your Cisco Prime or your networking solution, has a lot of information about where the device is located, what network connection it's connected to, what IP address it has. All that information can be pulled back without scanning and by connecting to those different solutions. And that's not where it stops. We can glean only so much information from the packets and pulling out that information. But by monitoring the device and looking for patterns in different ways using machine learning and AI, we can see reproducible patterns in particular devices and use that to determine, if this device is reaching out to a known GE support ID, we can look and see that, hey, we know that's a GE device now if we couldn't figure it out from the packet. If it's using specific protocols, specific ports, all these things can be built to build a profile around the device, kind of a unique fingerprint for that device, so we don't have to rely simply on the packets. And this is getting more and more important because manufacturers are getting better about security. Manufacturers are encrypting their traffic on the network. Unless you can have a key, you can't decrypt that traffic. And it's not generally a good practice to decrypt that traffic either. So these methods that we've been using in the past to identify what the devices are, the deep packet inspection, those kind of go away when you cannot inspect the packet any longer. You have to use other methods, being integrations, talking to your Alaris pumps, talking to they're encrypted. You can talk to the Alaris server and get information back about them to help populate this. So this, as we move forward, is going to be more and more critical that we use different methods outside of DPI to determine what these devices are. In addition to determining what they are, we now have the ability to profile them and baseline the behavior so that we know if they deviate from this behavior. So if we know a CT scanner should communicate with PACS, it's getting you're getting your patient information from another server, and it's got a couple of other things it has to do. It has to communicate with the reconstruction server and maybe an offsite PACS for after hours. It's 5 or 6 things that this device is going to do over and over and over again. When we build a baseline around that, anytime it deviates from that baseline and reaches out to the internet or another device within the organization, we can set off flags and say, hey, this isn't acting exactly right. Not only that, but we can monitor that traffic for any known malicious behavior. If it's reaching out to a URL that we know, or an IP address that's malicious, or the type of communication it's doing, if it's doing RDP across the network to another device, those are signs of intrusion within your network, and we can flag those as well with the information we have. So we're getting a whole bunch of great information about this device and also building ways to protect it in the future. In addition to monitoring it, we can use that profile, that fingerprint that we've built to build security things to do network segmentation. This has been very difficult in the past. Most manufacturers, when you ask them, what is my device doing? Who's it talking to? What ports, what protocols? They either just flat out say they don't know, or they give you an answer, but it's not a complete answer for your organization. And if you build your policies around that answer, it's going to break the piece of equipment, and you're going to lose some form of communication, and it's not going to be clinically viable to keep working and delivering patient care. So we've talked a lot about HTM, but this is one of my pet peeve slides. We have to break it down. We have to open the lines of communication between HTM, IT, security, network services. This is a team sport, both collecting the data that we have about the devices, sharing the data. You do not want network services shutting off your CT just because they don't know what it is. So if they know it's a CT and they know who to contact and it's doing something they don't like, instead of just turning it off, they're going to reach out to the person. They're going to open those lines of communication. And I encourage you, when they do open those lines of communication, be responsive. If they think they have a problem and you don't think it's a problem, act like it's the biggest thing in the world. Because when you have a problem and you need to talk to them, you should expect the same thing in return. So really break down those barriers and make sure that all the IT and network services and HTM and the organization are all speaking the same common language, and they all have the same information to work off of about the devices. So if there is an incident, minutes can lead to, every minute there's somebody in your network is multiple thousands more dollars in time it's going to take to resolve that problem. And if they're on the phone trying to figure out who owns an asset for hours, it's just compounding over time. So share that data and make sure everybody's working off of the same playing field. So Dustin, you wanna take this slide?
Yeah, definitely. Thanks, Ben. So this isn't just a one-way conversation, right? So when we were going through our asset onboarding, we looked at how we could incorporate the MAC address to be able to pull in some of this information. If you think back, this is literally the exact same information that was gathered from the network through passive discovery and was showcased within Ordr. So why is this important? Again, like let's think about the different ways that we can action on this. We've got the ability to ultimately assist with vulnerability remediation. That's going to be tied in. We have recall management, being able to better understand and isolate the devices that are actually impacted by a specific recall, because now we're often seeing that software version number as a component of that. And we can also start to understand ultimately like the host name, and we could actually see if this is on a particular VLAN through the network adapter tab within Nuvolo. So once we're taking that information in, we can also be pushing certain information back to Ordr and being able to ultimately start driving action, because as Ben just alluded to, it's not just HTM. When we're going through and we're performing work against medical devices, a lot of organizations have a state where anything beyond the wall is maintained by IT. If we do not have ultimately that leadership foundation and the culture of safety where we're being able to communicate back and forth, then all of a sudden this data ultimately it's not as impactful, because a good portion of kind of what we're seeing on the screen, we need to have those open lines of communication, because some of these elements we are going to have to deal with beyond the wall. So with that, Ben, I think we can go ahead and we can kind of play off of each other and really talk through the ideal state. I mean, we're really trying to make this easier. The whole demonstration, our whole presentation today, the thought process is we need better tooling, business processes, governance, and communication to assist us with that inventory. And as Ben alluded to as well, we need a means to fix some of that legacy data, whether it is bringing in an external party, whether it is clearing things up as you're performing the PM. But we got to start somewhere, and it definitely helps if we have automated reconciliation. And also, we have that chalk line ultimately set up, and then the ability to ultimately understand any of the new equipment that's coming in that may have showed up in alternative systems like Ordr, that will be able to tell us, oh, we have a net new device. Let's get that appropriately onboarded. Ben, I mean, what are your thoughts regarding the ideal state? How do we keep this kind of going in the right direction?
Yeah, there's a bunch to unpack there. So the ideal state would be that we're capturing everything every time it comes into the network, be it a network connected device or not. So there are, being network connected, that gives us some advantages. If it's going to show up on the network, we're going to be able to detect it in some way, shape, or form. But we don't have a great solution there for our non-network connected devices, which is another pain point. So I think one thing we haven't covered about making this, what should be included in your policies and procedures for onboarding is a clear path to supply chain. It's very important that you also have an open channel to supply chain. So when acquisitions are being made, or when they're making decisions about what devices to purchase, HTM is involved in that discussion, and that's there for many reasons. So you do know what's coming, but also you can help them and educate them to make better purchasing decisions. If it is a connected device, you should be auditing the cyber footprint of that device before you purchase it. You should be looking at multiple devices, and if they all clinically meet the needs of the physicians and nursing staff and so forth, the next step should be which ones are safest to go onto the network at your hospital, and you should be making your decisions based on that before you write a check. Because if it shows up on the dock and it's ready to be installed and it's already been paid for, you have no leverage at that point in time. So that's one thing that needs to be clearly defined in your policies of onboarding, purchasing, and so forth. Dustin?
Yeah, no, I think that was great, and couldn't agree more.
So one of the points you have there is Streamlined for recalls and vulnerabilities. This is I'm hearing this more and more from my customers. What can you do for me for vulnerabilities and so forth? And if you have a product like Nuvolo, you're in great shape, because they have a vulnerability management process in their OT cyber module, and they can work through these recalls and stuff with you. But a lot of you probably aren't in that position where you have a modern CMMS system. We still see some of the older AIM style systems out there, stuff that we've never heard of before, and they don't have the abilities to manage vulnerabilities outside of opening a work order. And I think this is a thing where we really need to focus as an industry and figure out ways to better manage vulnerabilities. So we've built things into the product that allow you to, if you don't have a CMMS that can manage vulnerabilities, you can do it within the Ordr product. Not only are we going to tell you what vulnerabilities we think affect the devices, but we're going to give you the ability to manage them, assign them to people, track them through their life cycle, and then eventually close them out when you either determine that they're not a viable problem anymore, or they've been addressed with a patch. So this is something that you can do, but even if you're not doing it in your CMMS or within a tool like Ordr, you have to start tracking this some way, shape, or form. And even if it's a spreadsheet, it's better than nothing at all. But more and more, as we look at the pressures that are being put on healthcare by government to follow certain security frameworks and so forth, if God forbid there were ever a intrusion into your network and it was through a medical device, questions are going to be asked. Did you know about the vulnerabilities? When did you know about the vulnerabilities? What have you done about the vulnerabilities? And if you're sitting across that table with lawyers and government officials and you can't answer these questions, it's a really bad feeling. So you really need to make sure that you're managing this right now. And then active risk scoring, the bottom one here. This is something that is difficult. I mean, we can take a look at something before we buy it and associate the risk on it. But as it goes through its life cycle and the operating system becomes obsolete, are we continually looking at the risk of that device to our environment? This is something that can be difficult because people get attached to their devices. You'll see a lot of old ultrasounds sitting in your cath lab that are used, once or twice a year, but they're still sitting on your network and they're Windows 7 and they're a possible point of intrusion. So looking at the risk to your organization from a cyber side, from the clinical side to say, hey, if we didn't have this piece of equipment, what would we do? And having the people in decision-making places that understand that getting rid of a piece of equipment is sometimes the answer if it's not being used enough and it's a big enough risk to the organization, or using other tools within your network that you may already have to protect those devices so they don't cause any problems, really restricting the communication. So if there was something they couldn't talk to other things, or limiting what can talk to them, so that that you reduce that risk to your organization. Dustin?
Yeah, one thing I would add there that I think you highlighted that's absolutely critical to understand is appropriate device offboarding as well. So you made the comment, if you ultimately can't control or mitigate certain elements of risk, it may be time to bring on a new device. In addition to bringing on the new device, if equipment has PHI on it, please use appropriate sanitation practices, whether it's performed internally or if you have to bring the vendor in for an appropriate wipe. I think it's another element when it comes to appropriately storing information to ensure compliance. It's just as important as appropriate onboarding processes. So
Perfect. So I
yeah.
just figured out how to use the questions box. So we did have a question come in, and it's for me, but I'll read it. Can you derive utilization from the connected devices using the automated process? And that is yes. So it depends on the device. Anything that is imaging related that uses DICOM, that's table stakes. Anyone should be able to determine how long the studies are taking, how long the device is in use, and so forth. Your infusion pumps are going to be different protocols, and depending on the protocols they are talking is how rich of utilization data you can pull from them. But most devices you can pull utilization information from, and the fidelity of that information is really going to differ depending on vendor to vendor. Some may consider a pump utilized if it's connected to the network. Some may consider a pump utilized if it is communicating on the network. And then some actually will say, for like the Baxter infusion pumps is a great example, we know if it's actively infusing. So we can say it's been actively infusing for this much, it's been sitting idle for this long, and it hasn't been turned on for this long. So yes, utilization can come from all this data that is collected, and it is a great way to help with capital purchasing acquisitions. If every hospital I've ever been to tells you they don't have enough infusion pumps, and it can't be true everywhere. This gives you the ability to say, okay, you have 400 infusion pumps in the last 30 days, you've actually only used 250 of them, and this 150 is either idle or missing. Let's determine if they're missing, find them, and get this back before we make any capital purchases for new pumps. So with that, I think we'll open it up to any other questions that we may have. There's also our contact information if you want to follow up on another forum. Please type them into the window. Linda, I don't know if you had any that I didn't see.
Yeah, one actually has come in. I'll read this one before I go on to the other ones. It's quite a long one, so bear with me.
No problem.
It says, let me bring it over here. It says, where would the best place be to encompass all of the levels of information surrounding an asset? I see how the CMMS could be a good solution to contain all that information, but that limits information to just HTM. How would you share this information within your organization, say with your IT network and security teams? Is this too focused to medical devices for it to be relevant to them? And what solutions do they use, and does it show the same information?
Yeah, I'll take a first stab at this, Ben, and then have you kind of come in towards the end. at the end of the day, we're working with different stakeholders kind of all across the organization. I gave the example of ultimately beyond the wall. Not everyone needs access to every data element. Okay, and I know that there's people out there that I'm sure want to challenge me on that, but at the end of the day, we need access to the information that's relevant to our particular role, and we need the information necessary to coordinate with those other parties. A good example, it's fairly unlikely I'm going to go basically perform work at a switch level if I'm a BMET. Like I don't anticipate that's going to be the norm for a good portion of your devices, and so you're going to engage IT. And in that case, they're going to be looking at the switch while you're communicating about how your medical device is interacting with that. It's a lot of cross collaboration, and so to kind of answer the question succinctly, you're still going to have people logging into multiple systems. I don't think you're going to. You could create a view either within Ordr or within Nuvolo or within a tool that is going to have every element available that anybody could potentially need. But at that point in time, I think you kind of get into too much data to be effective. So my thought process is you're still going to leverage different systems for depending on the type of work that's going to be performed. But Ben, what's your philosophy there, man?
Yeah, so from my experience wise, when we were doing this, we were working, I've done 2 modern CMMSs, one being Nuvolo, one Connective, which is no longer available. And the great thing about those 2 is that they're riding on the ServiceNow platform. And typically your IT organization in most hospitals is going to have ServiceNow. Or they're going to have some form of CMDB where they keep information about their medical devices. If they're both riding on the same platform, you're in great shape because you can create a duplicate CMDB record with the minimum information that your IT department needs. They need to know, the MAC address, the IP address. They need to know who the responsible party is and maybe your asset tag so that they know who to call if there's an issue and they know what to reference that is common for you to understand. If they call up and say, hey, I need to know about this device, this is the asset tag, you're going to know what to do with that information and be able to help them. If you're not lucky enough to be on a system where you can automatically share that information, my recommendation would be to have a policy or procedure that says every so often, every 30 days, you're going to output a list of all your active assets that are connected to the network that has the relative information on it, the IP address, MAC address, who to contact, the same stuff I just said. And then they can choose to either just have that as a spreadsheet, unfortunately, or whatever CMDB they're using should be able to ingest that just like you will be able to put it out. And they would have an updated record for contacting the appropriate person should they ever see, they're going to know the MAC address of a device that causes a problem and so forth. So it's one way you can do it. It's not a great way. But it's better than what we've been doing in the past, which is they just keep calling different departments until they figure out who owns the particular piece of equipment.
Okay, that's great. Another question here is, what are some best practices if my current CMMS database does not have the fields we need?
If you can, evaluate alternatives. I mean, as Ben just stated, you could, God forbid, like maintain certain spreadsheets off to the side, but at the end of the day, this is really the CMMS is in large regard kind of the lifeblood that is going to facilitate your success from not only a compliance perspective, but also operational effectiveness. So if you're not getting enough, I'd suggest an evaluation. Ben, do you have any thoughts?
Yeah, I'd say that'd be my first step is start making leadership aware that your current system is not adequate. Start that conversation, but in the meantime, there are some things you can do. Almost all CMMS solutions have a comment section for each asset or device. What my best practice for that would be to determine the information you need to collect and figure out a pattern that you can collect it in. So if you want to collect MAC address, IP address, host name, AE title, make the list, figure it out, collect it, and put it in the same order with a delimiter that is not used within it. So don't use a dash, don't use a colon, use a comma or a semicolon, so that when you do get to a system that can support it, you have it in a format that can be inputted so you don't have to type it all again. You can be brought out and then separated and then brought into the new product. So there are solutions that, once again, they're not great, but it will help you in the long run to not have to repeat the processes of collecting that data or re-entering the data into a new system.
Okay, what about this question? And who do you think should own cybersecurity?
Ultimately, it's a team sport. I think that's kind of the means that it has to be, because you have so many different stakeholders involved. So being able to have those direct lines of communication, but then also somebody ultimately needs to own cybersecurity. I think in the most successful organizations managing cyber right now, they have at least a small group of individuals that can really functionally have the conversation to both sides of the house. They can talk to HTM and they can also talk to IT, but it's not IT owns it or HTM owns it. Everybody owns it. It's a team sport at the end of the day, and that's really the only way we're going to be successful in ensuring the safety of our organizational reputations and also our patients and medical devices.
Yeah, and I couldn't agree more. It is everyone down to the end user of the device owns security. But when it really comes to it, when the stuff hits the fan, the CISO has ultimate responsibility for everything that's connected to the network. And they should be doing, like Dustin said, there should be those open lines of communication. And because medical device security is so vastly different than standard IT security, there needs to be people within the organization, and I know this is a struggle depending on the size of your organization, but that truly understand medical device security, understand IoT security, and what's possible, and the ways that you can protect these devices that are not traditional IT devices. And typically your standard IT security team is going to shy away from this. They're going to go to the easy stuff that they know how to protect. But that hybrid position, it's a growing position. You're going to see it more and more as it comes out. And as a biomed, if it's something you're interested in, I highly recommend getting some formal certificates or training within IT security and figuring out how you can play off of that, because these positions are going to become more popular, and they're typically, and this is an unfortunate thing, they typically pay a little better than a typical biomed position, which are kind of underpaid at this point in time.
Okay, so where should I start my cybersecurity journey?
So I think I covered a little bit there. Dustin, you want to start? And
Yeah, no, sure thing. It starts with the data. I mean, and that's really kind of what we covered today. I mean, we're talking about more data, more problems, some reconciliation concerns, some ways to get ahead of it. Your cybersecurity journey at creating that solid foundation from a data perspective, getting the right people aligned, which Ben really just talked about, having the appropriate skill set when it comes to medical device security. And I think once you have kind of those two elements, then it's starting to look at tooling and business processes that are ultimately going to assist you in your cyber journey. And I think that's where tools like Nuvolo and Ordr can really help you kind of take a stance that you are going to secure your environment, and we can ultimately assist you in doing that.
yeah, so I would add to that. I think there's resources out there. Amy has, I think, free resources on cyber for medical devices and learning about that. In addition, there are cybersecurity frameworks. They are more IT centric, more IT security centric, but they are what are being applied to medical device security. So if you look up the NIST framework, it gives you a framework around cybersecurity, and understanding that and looking at it and applying it to medical devices would go a long way to helping you in the journey of securing those devices. It is also part of some new government regulations that if you can demonstrate that you've been following a framework, typically NIST, for a period of a year, and you're diligently following the practices, and there's an event, leniency can be taken on your organization if you do have an intrusion, some form of ransomware, and patient data is lost. It will financially help your organization. So the right time to get started on this is today. Here's my email's on there. If you want to reach out, I can give you the exact regulations that you can take to your leadership to show why this is important and why they should be financially supporting you in these efforts. But the basics of it are what Dustin said, is see, know, and secure. You have to see everything that's out there. You have to know what devices you have, and then you have to figure out the ways to secure them. And it can be broken down that simple for almost every single device out there.
Okay, we've got time for one more question, guys. It's, if our data is already inconsistent, where do we start to clean it up?
I'm going to defer to you on that one, Dustin.
Yeah. So the biggest thing is start kind of thinking through that is have a strategy. Okay. I talked about a chalk line and really being able to have that strategy and moving forward and that governance structure. If we think about like GE, it's always a great example because I think most organizations probably still have 3 or 4 different versions of GE in their system. Start thinking through what you want your clean data to be. So how are we defining GE? You need to get acceptance from others in your organization that that's how we're defining it. Because if not everyone's on board, unfortunately, your effort's going to kind of go to waste. And then start crosswalking it, whether that's through a spreadsheet, and then you can bulk load some of that information. Have an understanding of how you want to transfer that and create ultimately a what was it, and what will it be, the is. And then you can slowly start feeding that data. At the end of the day, you got to start somewhere. And if you think back to what Ben had showcased regarding kind of legacy options, you can pay an organization to clean it up. You can work with organizations like ECRI. They offer data cleansing services, and there are several other organizations that can do that. Doug Brown does a good job if you want to look him up. So there's options out there. It's either arduous or you pay for it, unfortunately. But it's also something that should be thought about pretty deeply if you are considering switching up your CMMS. So, Ben, anything you'd add there?
I would add a couple things. The first thing would be is stop the hemorrhaging, stop the ability for people to manually enter key fields like manufacturer, model number, things that should be standardized need to go through a process so that they're put into the system and then they select from a list, kind of like Dustin showed with the onboarding portal. And then the next thing I would say is pick wins that are not necessarily, that are achievable, but not necessarily easy. So like manufacturers, standardizing your manufacturers, that should be a pretty easy one. It's going to be time consuming, but you can show results and outcomes, and you can have some easy wins. So start there and then work down to the harder ones.
Great. Well, thanks both Ben and Dustin for your time and for a really great and informative presentation today. I'd like to encourage everyone to visit today's sponsor to learn more about the products they provide to our industry. So please visit ordr.net. As promised, the answer to today's trivia question is California. So congratulations to our winner, Ryan Barry. A quick reminder, you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit from the ACI, and you'll be able to download your certificate directly from your computer once you've submitted the survey. If you have any questions, you can reach us at webinar@mdpublishing.com. We'll be back next week with another webinar, so please visit webinarwednesday.live for more details and complimentary registration. Thank you once again for your time today and enjoy the rest of your day.